Get out of pain without back or neck surgery. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas, and I'm coming to you with a pretty effective message, I think. This week we're going to be talking about ways that you can get out of pain without big issues like neck surgery and back surgery and a lot of cortisone injections and stuff that is borderline dangerous or at minimum invasive. Especially getting out of the big, serious, life-changing kind of pain. So that's what we're going to be talking about today. Now, many of you watching this video here on YouTube or Facebook, you've experienced the type of pain that I'll be talking about. And you can understand the significance and the intensity that we're going to be talking about. Some types of neck and back pain can be truly life-altering. It can be scary and can cause an extreme amount of anxiety while serving kind of a death blow to your confidence in your current abilities as well as your future abilities. You're already watching, but if you know someone like this in your life, share this information with them, please. You could help them avoid having unnecessary surgery with lifelong complications just by sharing a simple video with them. Just one button. It's pretty simple. I encourage you to do it. Back to serious pain. It can cause you to slip into what we call fear avoidance. And that means that you start to step back from things that you love doing because you're afraid you're going to hurt yourself again. When you have a hard time just getting yourself to the bathroom, well, let's be honest, nobody's in a hurry to repeat that kind of painful experience. Nothing I know of behaves quite like the pain that patients suffer after a disc injury. Sometimes that means intense pain at the site of injury. Sometimes it can mean excruciating pain in the arm or the leg, for example. Sometimes both. However it presents, it's like no other pain and can reach a level that not even morphine can touch it. It's just awful, y'all. Trust me, I know what I'm talking about. I've been there before. I played college football, and I was not very kind to my body for several years. About 20 years ago, I went through a bout of this very type of pain that I'm discussing here. A big old burly tough guy like me was reduced to not even being able to get to the kitchen or to the bathroom. It was just awful. It was nauseating. Some have experienced that intense amount of pain after something as simple as just turning or moving too quickly. And I know one patient that simply coughed. That was it. They just coughed a little bit and felt a little squish in their low back, and that turned into quite an ordeal for them. And when you consider that it can happen that easily and quickly, well, you have patients stepping back from activities fairly quickly to try to prevent it from happening again. And how long do you think that can go on, the stepping away from things we love? How long do you think that can go on before it becomes harmful to the person in the long term? Well, there are multiple ways to look at it, but here are two big ways. Number one is deconditioning, and number two is chronic pain. So let's go over both of those. Let's start with deconditioning. When we step back from the things we love and the activities that feed our souls or just simply make us happy, well, we begin to decondition, and that happens after only 7 days. And it takes much longer than 7 days to recondition to the level you were once at before you started stepping back from your activities. Now, this can cause a big problem if someone starts avoiding activities for extended amounts of time. Yes, that is completely unfair, by the way. It's similar to the best tasting foods being the worst for our health. It's so unfair. Some things just aren't right. But this is one of them. You decondition after only 7 days, and it takes a lot longer to get back to normal. Now, chronic pain. Let's talk about that for a sec. Most pain experts and organizations, they agree that chronic pain sets in somewhere around the 3-month mark. We're accustomed to assuming our pain is just going to go away as magically as it occurred, but that's not always the case. Sometimes you look up from your busy life and all of a sudden you've been hurting 4, 5, maybe even 12 months or more. Now the pain is chronic, and now it's much harder to get a handle on. So we don't have as much time to get out of pain before it turns chronic, certainly not as as much time as a lot of people assume you have. So what about alternatives to things like cortisone injections or surgery even? So some of the ways that we here at Creekstone Integrated Medical Clinic can help you avoid the pitfalls. This is what we're going to cover. Fortunately, a deep dive into the research literature by myself, I'm a bit of a research nerd, a deep dive into it proves and supports the use of lots of other means of treatment before ever considering surgery or cortisone joint injections, which are two of the very most common medical approaches to treating disc injuries, joint injuries, things like that. I'll cover each one of these alternatives more specifically, but briefly, they are non-surgical disc decompression, low-level laser, targeted exercises, spinal manipulative therapy, trigger point injections, and platelet-rich plasma treatment. So let's start with non-surgical disc decompression. Decompression was the literal game changer for our clinic when we added the treatment back in about 2013. It's non-invasive and it helps relieve the pressure that may be on the discs and causing some of the pain. We help create some space at the level of the injury so that the disc can have a better chance at healing and healing quicker. Research has shown that disc decompression can increase the size and hydration of the disc. It can fatten it up a bit, and that creates more space in the area. It's also been proven to potentially reduce herniations, suck them back in, and reduce some bulges as well as it rehydrates the disc. So, I mean, it is so effective, y'all. I cannot even begin to tell you. We especially have a chance of rehydrating discs and reducing herniations and bulges in the low back region. So these are the things that surgeons go in to take out. And if we can do this through non-surgical decompression, well, there's suddenly no reason for surgery, right? Not only that, but if we can buy the patient time with pain relief like this, the discs can usually heal up, and many times the material from the injury gets absorbed by the body and it simply disappears on its own. Again, no need for surgery when it works the way it's supposed to work. Like I said, it's a game changer for most of our patients that need it. Now, we like to try to be the very best that we can be in everything we do. So we spent time in Dallas getting certified in decompression, which not a lot of offices do. And it's worked out really well for us. Our patients get incredible results with decompression here at Creekstone when they weren't able to get results with decompression at other offices. And they get the results at a less expensive cost than many of our competitors. So it's a win-win for our patients. It's a good deal. Next is platelet-rich plasma therapy, also known as PRP. This new and emerging treatment for low back pain and hair loss and knee osteoarthritis and hips and shoulders and plantar fasciitis and elbows and tennis elbows and on and on and on. PRP is absolutely phenomenal and is shocking, by the way. It's just got so many uses, but PRP has shown impressive effectiveness for the main reasons for you to suffer from low back pain. The most common reasons for back pain are a disc injury, facet joint irritation, and sacroiliac or pelvic pain. PRP is shown in research to be a superior, effective, and fairly conservative treatment for all of those. PRP was found to improve pain and patient satisfaction while having no adverse events, meaning it didn't cause any complications. So not only that, but one paper showed it to be effective for disc pain, radiating into a limb, facet joint pain, and sacroiliac pelvic pain. So there's this research as well as research showing the most common alternative, which is cortisone injections, to be it's shown cortisone to be detrimental to the joints and not as effective overall as PRP in the first place. So the choice on this is clear. Next, we'll talk about spinal manipulative therapy, one of the traditional treatments used by chiropractors as well as doctors of osteopathy or DOs is spinal manipulative therapy, also known as SMT, spinal manipulative therapy. So SMT utilizes the fact that movement is healing. Movement is healing. When someone has surgery, well, they don't have them laying around in bed for very long, do they? No, they're moving and walking the hospital halls almost immediately. And that's because movement is healing, folks, even for a disc. Just ask a physical therapist. SMT is one of the easiest ways to get sore or injured segments moving, nice and gently, even if you're only slightly moving it. In addition, it can happen in a nice, gentle, non-aggressive way that can truly help to speed up the whole process of healing, pain relief, and confidence in being able to move and function. Next, we'll talk about exercise and rehabilitation. Anyone other than a physical therapist cannot use the term physical therapy when they're describing their services. But here at Creekstone, we are very big on physical therapy type activities. We're very big on movement, function, biomechanics, and returning our patients to their regular activities of daily living as soon as possible. And for that reason, we prescribe exercises that are specific to the patient's injury and their complaint. Sometimes a patient shouldn't be bending forward. They come in stretching and showing us how they can touch their toes, and that's the exercise they do every morning. And sometimes that's actually the worst thing they could be doing. And the patient should actually be going the other way with their stretches. When you have a provider like Creekstone's providers that understands how to determine the best exercises for a certain condition, well, then they can make a big impact on getting you over the hump incredibly quickly, safely, and conservatively. Next, let's talk about trigger point injections. If you've ever had significant pain in the neck or the back, you probably recall that the groups of muscles in the area of pain kind of clenched up or locked up. Well, this is a common guarding mechanism used by the body to prevent further insult or injury. Besides common stress and tension, this guarding can be a common cause of trigger points in the muscles. A trigger point injection can help soothe muscle pain, especially in your arms, legs, low back, and neck. Trigger point injections also can be used to treat fibromyalgia, tension headaches, and myofascial pain, which means muscle pain. Sometimes you can feel these knots when you rub your hand over your muscles. Injecting small amounts of anesthetic into the trigger point, as our nurse practitioner here can do, can alleviate the pain. The vast majority of the patients that have been having this done here, they say they never even felt the injection, and they have almost immediate relief afterwards. Next, we'll talk about low-level laser, also known as cold laser. Low-level laser is on the list of first-line therapies recommended by the American College of Physicians for back pain. That's a big medical group right there, folks. Cold laser sends charged photons into the tissues where it stimulates them into repairing themselves. The amount of inflammation in the damaged area, it goes down as well, and your pain will begin to lessen typically. It may take more than one treatment for this to work, but the results, they can be pretty impressive. Each treatment only takes about 5 minutes, even though the photons will continue to work for some time afterward. It's an excellent ancillary treatment for disc injuries and decompression, since it's great at reducing inflammation, which is one of the biggest reasons for the pain, and it may help the disc heal up faster. Some research suggests 3 to 6 times faster. That means our patients get out of pain quicker when they combine low-level laser with non-surgical decompression. They go great together. Now let's put all of this information together and see what it looks like in a pretend patient. So let's pretend a new patient comes into our clinic with low back pain, which is caused by a disc injury. Now we know that the best answer to getting them back to normal quickly is a broad multimodal treatment plan, which means several different treatments all working together in synergy towards one goal, which is getting rid of this pain. Now knowing this, we'll do an exam and we confirm, yeah, it's a disc that is causing all this pain, and there seems to be no worries that would warrant referring for a surgical consult, and there's no emergencies here. Therefore, during the exam, we're going to determine the best exercises and movements to get going for the patient so that we can speed up the healing process and provide some at-home self-management tools for the patient when they're not here in the office. Also, we'll give them some biomechanic talking and instruction or education as far as how to use their back in their day-to-day activities when they're not here in the office. Then we recommend non-surgical decompression combined with the low-level laser so that we can get the pressure off of the segment and reduce the inflammation while we try to stimulate a faster healing process. At the same appointment, we would gently get the segment moving through spinal manipulative therapy, and patients love this part because sometimes spinal manipulative therapy alone helps relieve some of the pain and the pressure that they're feeling almost immediately. Also, in the same visit, our nurse practitioner can evaluate the patient as well and see if they've got any muscle guarding, and with the patient's help, determine whether trigger point therapy is going to be done to address the locked up muscles. If after a week or two of doing this, there's little to no positive response, well then we would consider having the patient begin PRP injections. We bring out the big hammer. Outside of all of that stuff, we've also got acupuncture and massage available to these patients. There's lots more stuff, we just don't have time to get into it all. Now you can see why having options like these all under one roof is really the ideal and most beneficial way of getting out of pain. In this day and age, there's been no more effective means of treating patients for pain than we've got available right here at Creekstone. Not only getting out of pain, but getting out of pain quickly, safely, with little to no significant risk of complications. And doing it with providers that are evidence-based and patient-centered. What does that even mean, right? That means that we do what the research suggests we should do. We follow guidelines in our field, and we only do what is in the best interest of the patient, rather than what's in the best interest of our budget and our clinic and our finances. We always keep the patient at the center of what we're doing and how we treat you. Now, if we can help you or a loved one, we encourage you to call us at 806-355-3000. Let us get you on our schedule so we can help you get back to your old self. If you're watching on YouTube, subscribe, comment, and share. If you're on Facebook, right now, I want you to go like, comment, and share. You literally can change someone's life with such a simple gesture. Until next week, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas. Take care, and we'll see you then.